Welcome back to Father and Son Investing, the channel that wants you to get your young people involved in investing. Do it. If you haven't looked at our previous video about how to set up a custodial account for your young person in your life, we used Charles Schwab. You can go back and look at that video that we did a long time ago. And there is a referral code there. I don't get any money for it, but if you use the code, you'll get an extra $100 if you put in $1,000 for your young person. Today we're going to talk about Clover Health. Yeah, I know a lot of you out there think that Clover is a bogus company and it's plummeted. Its stock price has come way down. I still believe in Clover. I've made a whole bunch of videos about it, so I'm in on Clover. I've made some purchases while the stock has been a little bit lower. Why are we talking about Clover Health? Well, here's a great example of how I use WEBULL. Besides just the stock charts, which shows that, wow, it went up really fast, starting about 2:10 this afternoon. But this is what I want to show you. Down here where it shows news, it's really hard to come by stock news sometimes. If you just Google what's happening with Clover Health and why it went up today, I didn't get much. But if you look at the news here, they've already got 2 articles on WEBULL about what's happening with Clover Health today to explain to you why this stock price is up. So we're going to talk about that. I want to also show you something from the question and answer from CMS as to why this is really important. Sometimes we just assume if a company is included on an announcement, well, they must be doing okay. All right, here's the official announcement on the CMS website. CMS stands for Centers for Medicare and Medicaid Services. They announced today that they have 53 direct contracting entities, otherwise known as DCEs, that will be participating essentially in a pilot program starting actually April 1st of this year. It's going to run for several years. Now, why is this important to Clover Health? Well, if we click this box right here, it will give us a list of all the companies that will be participating in this pilot program. And if we scroll down to the bottom of the first page, there we have it. Clover Health Partners, they are participating as a standard DCE type, and it lists the states that they participate in. All right, so Clover Health got included among 52 other direct contracting entities. What's the big deal about that? I want to drill down into the question and answer page because this is what the big deal will be in terms of this investigation that's been rumored going on with Clover Health. So let's just quickly get to the question and answer page. Here's the question that I want to show you. It's question number 18. How will CMS select participants for the model? Well, the way that they're doing it is by 5 key criteria. And the first one is organizational structure. The second one is leadership and management. The third is financial plan and risk sharing experience. Fourth is patient-centeredness and beneficiary engagement. And fifth is clinical care. And then pay attention to this statement. In addition, CMS will consider whether applicants have demonstrated that their organizational structure promotes the goals of the model by including a diverse set of providers, suppliers who demonstrate a commitment to high-quality care. What do I get out of this answer to question number 18? They're only including entities who have an organizational structure, leadership and management, and other factors within their business that they think will essentially be successful and reputable. So if Clover is in big trouble with this muddy waters investigation, that they talked about, then why would CMS include them within this pilot program? Question to ask there. As I stated in another video, I think really, sometimes investigations and fines are just part of doing business with CMS. And in fact, if you go back and watch my last video, you'll see where I list a page that shows the companies that have been fined by CMS in the last few years. And they include big companies, including Humana and Aetna. It just happens, I think, when you're dealing with CMS. All right, what is this program? I don't want to bore you with too many details, but essentially it's a new way of risk sharing that CMS is working on to see how well they think it will function. In my personal opinion, I think it's just CMS's way of shifting responsibility for payment to other people. They're trying to cap their own expenses. Now, by this risk sharing, they can either do it at 50-50 or they can do it at 100%, meaning the direct contracting entity takes on 100% of the risk. In my opinion, that sounds a little scary. If you have a lot of sick patients, you could rapidly go into the negative. But I'm sure insurance companies, they have people who figure this kind of stuff out. In fact, I have a daughter who got her degree in things like this, figuring out what the risk is. For Clover Healthcare, this gives them some flexibility in the way that they manage patients. CMS can be very particular about their rules, and this gives Clover some enhanced flexibilities, it says, as they take on increased financial risk. What difference will this make for Medicare patients? Well, in addition to reducing burden, it supports a focus on complex and chronically/seriously ill patients. So it's designed to help try to improve their lives. All right, that's it for Clover Health. I don't want to dig too much more into the weeds because I know a lot of people will not be interested in that. Just one more quick plug for WEBULL, great way to get news on your stocks. You can see some of the other medical stocks over there that I'm following and interested in as well. A lot of them are in the red today. That happens, but they'll be back. All right, until next time, enjoy your investing.